Okay, this is the Smith & Nephew Regeneten Peak Bone Anchor Gun. Instructions for use. I'm going to show you some technicalities on this before I show you how to use it on an implant. This thumb switch here releases this tissue protector. So you'll go percutaneous through the skin with this. Thumb switch releases this. These 2 points are the bone preparation, I guess, spikes that are driven by this piece here. All right, this is all one piece. I'm gonna reset this kind of like a handgun. I'm gonna pull this forward, okay, and it puts your tissue protector back around those bone preparation spikes, okay? So you percutaneously through, implant is already on. These are for lateral bone support here. So once you're through tissue, down to bone, you can hit your thumb switch and it releases those spikes. You place those on bone at the lateral portion of the implant, okay? Once you have those in place, you're gonna hold here and you're gonna mount that down to bone, all right? Once you're down to bone, you want that cylinder all the way down to bone. This round cylinder goes clear to bone, okay? Once you're down, you're gonna squeeze the handle without moving anything else. You pull the handle. What that does is pull these spikes out of the bone and you remove this, okay? This now comes out. This is the peak staple that goes in place of it, okay? It goes in the same way. It's keyed, so it only goes one way. Slide that down the cylinder here. You're gonna release the lever, all right? Then you're gonna tap this in. It doesn't take quite as much force as the original preparation did. Tap this in. Once that's down, you squeeze the lever again, okay, and release. Everything comes out. What that did was place a bone anchor down on the implant that stays behind permanently, okay? Now the gun, you can remove this anchor device, I guess. Set that aside. We're gonna put our preparation device back in, same way, it's keyed. Slide it in. There's a notch here that this clicks into, all right? Put that in that notch. Slide this forward again like a handgun to cover your protection sleeve, and you're ready to do it again, all right? That's how that works. Done.